Hi, welcome to my channel. Today's topic is pharmacology of chlorpromazine. So, chlorpromazine is one of the antipsychotic drugs. You can call it as a neuroleptic also. It is a category of phenothiazine drug. If you see the classification of neuroleptics, you will find the phenothiazine category. In that, you will find aliphatic side chain type of drugs. Chlorpromazine. So, why we are using this chlorpromazine means if any psychosis patients having some positive or negative symptoms, in that the particular antipsychotic drug is the prototype of antipsychotic drug is chlorpromazine. First, they will prefer this drug to reduce the symptoms in the psychosis patients. Okay. So, chlorpromazine, I'll write as a abbreviation as like this: chlorpromazine. Okay. Chlorpromazine will treat specifically mental or mood disorders. So psychosis comes under mental disorders. Okay. It also used to treat tetanus. Okay. So chlorpromazine have a capacity to reduce the symptoms like irrational behavior, it also reduces the agitation, and also reduce the lots of psychotic symptoms. And it also reduces the desire to hurt yourself or others. Okay. Chlorpromazine suppress the symptoms like hallucination, delusion symptoms, and hyperactivity. To suppress the hyperactivity. These two, hallucination and delusions, are positive symptoms of psychosis. If you check my previous video, you will find how these positive symptoms will occur in your body, like hallucinations and delusion in a endogenous signaling molecule. I have explained that mesolimbic pathway, the dopamine pathway is one of the dopamine pathways, how these symptoms will occur. Check out my previous videos for how the positive symptoms of psychosis will occur. Okay. Chlorpromazine, it also makes feel less nervous. It makes to feel less nervous, and it will think more clearly. Chlorpromazine makes you less nervous and makes you to think more clearly. Okay. More clearly in the sense means, if you see some psychosis patients, they are apart from the reality. Okay. In that situation, the chlorpromazine will think that more clearly. Oh, this is the reality. We have to behave like this. Okay. Yeah. If you see psychosis patients, they will feel nervous. They will fear they will fear from anything, the structures or any the ghost related things. They always fear the psychosis patient. The chlorpromazine makes feel less nervous. Okay, so that's why they always choose give first preference to chlorpromazine as a antipsychotic drugs. Okay, if you see the pharmacology of chlorpromazine in your body means, for example, if you check with the CVS system, chlorpromazine blocks the alpha 1 receptor. It blocks that means chlorpromazine blocks the alpha 1 receptors that makes hypotension. That makes hypertension. So how the positive symptoms of psychosis will occur means chlorpromazine have a potent D2 receptor blocker. If we block the D2 receptor means they can reduce the positive symptoms. What are the symptoms they will occur in the psychosis patients? Okay, that's why the chlorpromazine they have chosen as the first preference drug. So chlorpromazine is a potent D2 receptor blocker so that they can reduce the dopamine endogenous contact with D2 receptors. So how the positive symptoms will occur means excess release of dopamine endogenous signaling molecule that leads to hyperactivity of D2 type of receptors that leads to positive symptoms of psychosis. So that's why the target of chlorpromazine is blocking the D2 receptor activity. Okay. So dopamine will not give the signal to the receptor to do some intercellular process, intercellular signaling. Okay, that leads to the positive symptoms of psychosis. Chlorpromazine is also have a potent to block the alpha 1 receptors that leads to hypotension. Okay. Let's see the mechanism of chlorpromazine. So this is the synapse between the ventral tegmental area and nucleus accumbens in the midbrain region. Okay. So in this synapse, in this region only, majority, the 60% of dopamine will produce. So that's why they target in this area, the researchers or scientists, they target in this area to block the dopamine receptor activity. Okay, specifically D2 receptors. D2 receptors are present on in this area nucleus accumbens here, exactly here. So that's why they target the D2 receptors. D2 receptors. Okay. So lots of dopamines will produce here. It will stored in this mantle vesicle. Whenever they need, they will release the dopamines and bind here. It will come here. These are the dopamines, the dotted lines, and makes the positive symptoms of psychosis. That means hallucinations and delusions will occur. So we have to block in this area. That's why the scientist has make the target to the D2 receptors so that dopamines, these are the dopamines. So like that, chlorpromazine will block the D2 receptor activity. Let's see more clearly. So I'll make one D2 type of receptor here. So assume this is a D2 type of receptor. Okay, dopamine type 2. So here, so this is the VTA region and this is the nucleus accumbens region. You know very well, here lots of dopamines will produce. For example, I'll make some more clear here. So this is the dopamine, this is the binding site. It will come and bind here. Okay. So assume that it will come out from this neuron and come to the synaptic cleft. In this, the gap between the neuron to neuron, it will come and bind here this dopamine. Whenever this dopamine will bind with the D2 type of receptors, excess release, excess amount of dopamine will make the hyperactivation of D2 type of receptors, leads to hallucinations and delusions. These are the positive symptoms of psychosis. Okay, now how the chlorpromazine will block this dopamine binding? We'll see. So assume this is a chlorpromazine drug molecule. CPG will come and bind here exactly in this location. It will reflect this. So it is preventing the binding of dopamine molecule to the D2 receptor, which leads to hallucination, delusion. Then what is the use of chlorpromazine? It is suppressing the hallucinations and delusions like this, binding to the exactly D2 receptors, deactivating this receptor activity, D2 receptor activity. Okay, like this, chlorpromazine will suppress the positive symptoms like hallucinations and delusions. So till now you know that chlorpromazine having antipsychotic activity. Chlorpromazine also have anti-emetic activity. Emesis means vomit, nausea feeling will come, right? So anti-emetic, it will stop the vomiting. It will control the vomiting. How? We'll see. Exactly, this chlorpromazine will deactivate some more receptor activation. For example, assume this. So how the vomit will come means stimulation of chemo trigger zone. Whenever the chemo triggered zone is stimulated, you will get vomit. So it is this chlorpromazine will go and deactivate this CTZ activity. So vomit will control, vomit will not come. If you see in receptor mechanism means in chemoreceptor trigger zone, for activation of chemo trigger zone, we need specifically three types of receptors. One is M1 type of receptors, muscarinic type 1 receptors. So another is obviously D2 receptors is present. We have to block the D2 receptors. And one more thing, histamine type 1 receptors. So how this chlorpromazine having anti-emetic activity means chlorpromazine will come and bind chlorpromazine it will block all these three types of receptors, so no more receptor activation in the that leads to stimulation of chemotrigger zone, no more vomit. So chlorpromazine having one more activity like anti-emetic activity. Specifically, how it is uh, playing a major role in antipsychotic activity means it is blocking the D2 type of receptors. It is preventing or suppressing the hyperactivity of D2 type of receptors which is present in a nucleus accumbens region. Here, how this anti-emetic activity means it is suppressing these three types of receptors. Muscarinic type 1, dopamine type 2 receptors also present in the to make the stimulation of D2 receptors and histamine type 1 receptors. Whenever these three major receptors are blocked, you won't get vomit. Every anti-emetic drug having a mechanism like this. Every anti-emetic. So chlorpromazine is also having anti-emetic activity. So how these bindings or blocking of this type of receptors, and you won't get vomit. Okay. Then that is about some pharmacology of chlorpromazine. This is some more points also. Whenever the CVS region, cardiovascular system, chlorpromazine, it will block the alpha receptor that leads to hypertension. Okay. Then chlorpromazine have a similar activity like procaine. It has a same potent as procaine. Procaine is one of the local anesthetic drugs. Procaine is one of the local anesthetic drugs. It has a chlorpromazine have a same potent as procaine do, but doctors they won't prescribe chlorpromazine as a local anesthetic because chlorpromazine have it will give some irritations to the skin. So that's why to the particular part it will give some irritations. That's why the chlorpromazine it won't come under the local anesthetic drug, but it has same potent as a procaine. Due to the irritation, they won't prescribe as a local anesthetic drug. Okay. Chlorpromazine it will affect the endocrine system also. It will decrease the growth hormone release. Chlorpromazine it will decrease the adrenocorticotropin hormone. Chlorpromazine it will decrease the antidiuretic hormone. It will decrease the gonadotropin hormone. It will decrease the gonadotropin hormone, and it will increase the prolactin. So chlorpromazine will increase the prolactin hormone that leads to specifically galactorrhea, gynecomastia. So galactorrhea means abnormal release of milk from the mother. Abnormally it will release the milk. So the due to whenever the pregnant lady or the mother will take the chlorpromazine drug that leads to increase prolactin hormone that leads to galactorrhea. And gynecomastia means it will increase the breast size in the males specifically. Okay. This chlorpromazine will disturb the normal physiological process which will happen in the body. Okay. So this is about some pharmacology of chlorpromazine. Let's see some side effects. Every drug has a side effect. Okay. Obviously, the chlorpromazine also having some side effects, like it will give drowsiness. Whenever you take this chlorpromazine, you may feel drowsiness. You may get some dry mouth. It may happen some constipation. You may feel lightheadedness. You may feel blurred vision. You may weight gain also. So these are some major side effects you can find whenever you are using the chlorpromazine drug. Okay. Whenever you are studying about any drug means you have to know about drug interactions also. Okay, that is very important. If some patient having hypertension, including psychosis, is having some depressions, extreme depression, it leads to about to get psychosis, the doctor will prescribe the chlorpromazine to reduce psychotic symptoms. Hypertension drug, for example, if you're taking some epinephrine drug to increase the blood pressure, you are having some low blood pressure. For that, doctors will prescribe the drugs to increase the blood pressure. So one of the drug is epinephrine. If you take chlorpromazine along with epinephrine, or thiazide drugs like diuretics, leads to decrease in blood pressure. See, it will decrease the blood pressure. The drug interactions happen. It leads to some abnormal physiological process. Abnormal process will happen. It leads to some abnormal condition like decrease in blood pressure. So these are, you have to know about the drug interactions also. So whenever, for example, you are the doctor, you have to gather information about the patient's patient history, also medical history and everything. According to that, you have to prescribe the drugs, right? So chlorpromazine, if interacted with epinephrine or thiazide type of diuretics, it leads to decrease in blood pressure. Like that, chlorpromazine interact with quinidine means it leads to increase in myocardial depression. It leads to myocardial depression. It will depress the myocardial muscles hard. That leads, whenever the depressions happen, excess depression, it will depress the function of the heart. You may get some arrhythmias also. Okay, arrhythmias is irregular heartbeat. Whenever chlorpromazine is taken with benzotropine or with alcohol or with antacid drugs, any type of antacid drugs, it will decrease the absorption of chlorpromazine. So what will happen? If decreasing the absorption of chlorpromazine means the exact 100% or accurate therapeutic activity will not happen. So what is the pharmacokinetics? A process of absorption, distribution, metabolism, and excretion. This is the process will happen whenever the you have taken some any kind of oral drugs. Okay. If absorption is not happen properly means distribution will also affect, metabolism is also affect. You won't get therapeutic activity. You won't get potent exact antipsychotic drug. Antipsychotic property you won't get. Okay, that's why you should not take chlorpromazine with benzotropine or nor alcohol nor antacids. It leads to decrease in absorption of main drug, the chlorpromazine. Whenever chlorpromazine is interacted with some kinds of drugs like so whenever chlorpromazine is interacted with some kind of drugs like barbiturates or any lithium or tricyclic antidepressants. Tricyclic antidepressant drugs, whenever you have taken chlorpromazine with any type of these drugs means it will affect your clearance of drug. It will increase the clearance of chlorpromazine. Fastly it will move from the body. Then it will affect the therapeutic activity. Antipsychotic drug. We are talking about this, right? So these are some major drug interactions of chlorpromazine. Okay. Let's see some withdrawal symptoms also. Withdrawal symptoms of chlorpromazine drug. So before telling to the doctor or physician, you have suddenly stopped usage of this chlorpromazine means withdrawal. You have withdrawal from the drug. Suddenly, withdrawal symptoms will occur. Before, without telling to the physician, you have discontinued from taking that particular drug means you will get some symptoms like nausea. You may feel nausea. You may feel vomiting. You have some trouble in sleep. You may get, you won't get hungry at all. Loss of appetite will happen. loss of appetite. So these are the major withdrawal symptoms you may find. Okay, nausea, vomiting, trouble sleep, loss of appetite, or you may get some muscle pains also. So these are the major withdrawal symptoms of chlorpromazine. So that is about the pharmacology of chlorpromazine is one of the neuroleptic drug. So if you got the concept means, please like and share the video. If you want to see the more later videos means, please subscribe my channel and push the bell notification. Okay. Have a nice time. Bye.